Stand by everyone, we are going live within few seconds. Stand by everyone, we are going live within few seconds. Stand by everyone, we are going live within Ladies and gentlemen, good morning. Today we have invited some of our distinguished guests. This program is organized by Central London Youth Development Trust. They have an extensive research work in terms of the vaccination COVID-19 during the pandemic, and then a lot of research found that during the COVID-19 pandemic, BAME community, black, ethnic, Asian and minority community and the Muslim community and hugely affected, but the vaccine intake was not sufficient among the ethnic community. So that is why this consultation is really important, and this consultation and the program is chaired by the Central London Youth Development Trust, Councillor Aziz Toki, and we have a long panelist, those from the ethnic background and those who are professionals. We invited them to discuss, and during the pandemic our panelists were involved directly with the COVID-19 victims, and they treated them, and they have a huge experience working with them, and they will share their experience. And this program will be coordinated by me. My name is Tanveer Ahmed. By profession I'm a journalist, and I have a huge experience from the day one when I took interviews with the black and ethnic minority community, especially British Bangladeshi community. I went to their home and talked to them, and learned first-hand experience. So I'm requesting Councillor Aziz Toki to explain why this consultation is important, and what the Central London Youth Development Trust are going to achieve through this consultation. I'm inviting Councillor Aziz Toki to express his views in this regards. Sorry, you have to unmute Councillor Aziz.
Thank you very much. Good morning and warm welcome to our COVID-19 vaccination online show. I am Abdul.
I can't hear you.
You can't hear?
Yeah, it's better now. Yeah.
Is it better now?
Yeah.
Good morning. Thank you very much, Tanveer Ahmed. Good morning and warm welcome to our COVID-19 vaccination online show. I am Abdul Aziz Toki, Director of Central London Youth Development Trust. The Central London Youth Development Trust has organized this show with the support of Kensington and Chelsea Social Council. The show will be a multilingual show. We will use 3 languages such as English, Bengali, and Arabic. Not necessarily our guest will speak all those languages. However, we have some people in online to interpret and support us. Research shows that ethnic minority people are far behind in taking COVID-19 vaccine. There are so many reasons. Central London Youth Development Trust has initiated this project, Mind the Gaps. We can aim to reach those people, increase their confidence and trust, and explain the vaccine's benefit. I'm grateful to Kensington and Chelsea Social Council for their support to shape up this program. Today in our panel, we have guests with robust knowledge to explain the benefit and importance of vaccination. Viewers, if you have any questions or query, Please feel free to ask. Our expertise will answer your questions. In our today's show, we are joined by Dr. Manzoorul Shaukat, Clinical Lecturer, Faculty of Medicine. He will join us within a short time from Imperial College. Dr. Jinaat Khan, a specialty, Dr. Elderly Care and Strokes, Ulster Hospital, Belfast. Dr. Aziz, GP, and Maulana Nazrul Islam Khatib and Imam Decline Mosque. My wholehearted thanks for their generosity and participation in our program, especially in weekend time. Our anchor, journalist and researcher, Mr. Tanveer Ahmed, is the main architect of the show. I'm sure all of our viewers will be benefited from this program. May I request Mr. Tanveer Ahmed to conduct the rest of the program. Thank you very much.
Thank you very much, Councillor Aziz, Director of Central London Youth Development Trust. Before I go to our panelist, so I want to share some of the information why this consultation is really important for the black and ethnic minority, especially the British Bangladeshi community and the Muslim community. So hope you can see some of the information I'm going to show through. According to ONS data published during the pandemic, first wave of coronavirus and COVID-19 pandemic, 24th January 2020 to 11th September 2020, people from all ethnic minority group except for women in the women in the Chinese or white other ethnic groups, and the higher rates death involved the coronavirus compared with the British population. So the death rate COVID-19 was highest for the black African group, 3.7 times greater than for the other British group for males, and 2.6 greater for females. Forwarded the Bangladeshi community 3 for males and 1.9 for females. And you can see the black Caribbeans 2.7 are male, and the female was 1.8. It was I'm talking about the first pandemic, first wave of the pandemic. And the Pakistani community 2.2 males and 2 per for the females and ethnic group. If you go down, and you can see in the graph chart the highest rate affected by the Bangladeshi community in the chart. I hope you can see the chart I'm showing. You see the Bangladeshi is the first, and the black African in the second, and the black Caribbean in the third, and the male and the female as well. The female, the black African is the highest. And next, go to another slide. The male of black African ethnic background had the highest rate of death involving COVID-19, 2.7 times higher than the males of the white ethnic background, and the death rate is really high. And this data, according to the ONS, published in the 2nd of March, 28th of July 2020, and registered 24th of August. Here we can see the white counterpart was, the death rate was 106, and you can see the black Caribbean and ethnic minority community was the highest in 207. And then Bangladeshi community was the highest among the death rate in 270. So this is the death rate, and then second wave, you can see the that was the male, and the female was the same. And then Bangladeshi community's death rate was 111, and the Pakistani community was 115. So this is the situation and the statistics by the national, Office for the National Statistics. Now I am going to take you another research by the UCL. After considering all the data by the ONS, and UCL published another research on COVID-19 vaccination uptake among minority group. That was this data and research published on 7th of April 2020, or and when the pandemic's done. And they findings showed that the among black ethnic groups vaccine uptake was between 57 to 65% compared with 90% uptake in white British groups after the 6 months of the vaccine rollout. So you see the difference between the vaccine taking ratio with the white groups and the ethnic groups. And now I'm going to ask our panelist reaction in regards to these statistics and the research so far we have seen in the screen. And you can speak in Bengali, English, or Arabic, and as Councillor Aziz mentioned, we have Arabic translator as well. If anyone asks any question, they can answer. So first I'm requesting Dr. Zinnat Khan. Dr. Zinnat Khan is a specialty doctor in elderly care and stroke in the Ulster Hospital, Belfast. Dr. Zinnat.
Assalamu alaikum. Thank you very much, Tanvir Bhai, for giving me the opportunity in this platform to express my views on this really burning topic, vaccination. As you have very clearly shown that vaccine uptake, despite all the data available and all the evidence base available for its effectiveness, the uptake of vaccination is actually not very satisfactory amongst the ethnic background, especially the BAME community, especially Bengali community. In my area of work, I work with people who are 65 and older. Obviously, the stroke patients can be younger as well, but what I see from my point of view, from my area of work, if you're slightly older, 65 and older, especially if you have other comorbidities and if you have autoimmune condition or you're immunosuppressed for any reason, COVID can really affect you. Really, you can have a really poor and bad outcome if you're not vaccinated. And there has been significant data available where you can see if you're vaccinated, triple vaccinated especially, even if you have the disease after triple vaccination, your outcome is not as bad as people compared to people who are non-vaccinated. And the vaccines available now are all halal certified, are all vegan and vegetarian approved. So I don't see any reason, and they're very safe and very effective. That's probably the most important thing, with very minimal or no side effect. I mean, it's intramuscular injection, so people experience local reaction like a bit of muscle pain, and sometimes people can experience very mild viral illness, but it's nothing compared to actually COVID itself. So even if you think about not just COVID, if you even have a mild viral illness, now we are seeing a lot of people, what we call is long COVID, which is again having a significant impact on quality of life and outcome related to other comorbidities as well. So even if you think that, okay, COVID is a mild illness, it's not going to do any harm, and like any viral illness, a lot of people actually, I think, oversee the long COVID side of things. It can affect people in a variety of ways. I have colleagues who are very active, very well, now off sick for years with long COVID. So, and they're young, etc. And you can imagine what effect it can have on people who are slightly older, slightly more vulnerable, and have other comorbidities. So my, if you want to take home one single message from this consultation, I would urge everyone, if you're invited for vaccination, please go for it. And with ethnic background people and BAME communities, we live in smaller households. There are multi-generational people in single households. So if there is an outbreak of COVID within your household, it will, and it does spread like forest fire. So you're not only you're not really suffering just by yourself, you are making people who are around you more vulnerable as well. And that could include babies, children, etc. And if it comes to pregnancy and childbirth and postpartum period, it has been shown effective, safe in pregnancy. And women in childbearing age, of course, if you're pregnant and if you're not vaccinated, there is data available from Royal College of Physicians that you risk early childbirth, you risk low birth weight babies, and obviously these babies have poor outcome. And if women during pregnancy are vaccinated, it does not cross the placenta, so it actually does not have any effect on your babies. And if you think about it, vaccination is actually available right from childbirth. We are vaccinated against BCG, mumps, MMR, lots of diphtheria, etc. So we are actually vaccinated right from our birth, really. Whether you're born in this country or born in any other country. So I don't see why would you have prejudice or negative ideas about COVID vaccination. If anything, it's safer. It's newer generation vaccine, and it's safer. It does not alter your DNA. It does not do any of that. It does not do any genetic mutation popular to all the conspiracy theories. It's very safe. It's very effective. And if you look at your healthcare professional, more than 95% of British healthcare professionals are vaccinated. So that's telling how safe it is. People who are actually advising you to take it for themselves. So you can imagine how safe and effective it is. So I would urge everyone, if you're invited for vaccination, please do go for it. Do it for yourself, do it for your community and people around you.
Thank you very much, Dr. Zinat Khan. Before I move to next panelist, I want to show another data. The question the Dr. Zinat has raised, why people are not interested to take a vaccination, especially within the British, Bangladeshi or ethnic minority community. I have another ONS data to share with you. Let me take you there. The population of the people aged 18 years and over who received 3 vaccinations continued to be highest of those identifying as white British, 77.1%. The lowest population of the people continued to be in the Black Caribbean, 38.9%, Black African, 45.9%, Pakistani, 45.9%, and ethnic groups. And they have found a few reasons. The population of adults who received the 3 vaccination also continued to be lower of this. They're living in the more deprived areas, urban areas, or social rented housing, who were not born in the UK or did not have English as a main language, who have never worked or are long-term unemployed, and who are limited a lot by disability, and who identify as a Muslim, who were male. And this data published on 14th of July 2020. Now I'm moving to our next speaker, Muhammad Abdul Aziz. And Dr. Abdul Aziz himself suffered coronavirus, and he was the first person I went to his Barking GP when the first coronavirus case found in London. So I remember the first day the virus found in Luxford GP, and he was the first doctor I met during the pandemic. Dr. Aziz, your floor is yours. You have to unmute, Dr. Aziz.
Alaikum, everybody. I'm so pleased to be invited by our friend Tanvir Ahmed, who is known to us for a long time, and he's doing lot of voluntary works for the community. We are pleased with him and his family, and we work together sometimes for the community, for the the media, for the Channel S, and all those things. And I don't know where to start with. It's a big subject. And I deal with all these, COVID-related patients now, everyday life, and a lot of memories, a lot of things to talk about. But today we are discussing about the vaccination most probably, mainly. And I remember the first vaccine which I got, was it 2021? Was it 2022? No, 21, yeah.
21.
21. Okay. Say in December, yeah, in January, I think. Yeah, when it came in the first time, and I did not decide yet, whether I will go for the vaccine or not. And there was a vaccine clinic going on in my place, working place in Barking hospitals. And one of the nurse came, Dr. Aziz, do you want a vaccine? Then I told, okay, just wait 1 minute. I asked my daughter, she is a GP as well. I asked her, Ammo, should I have the vaccine? Without asking anything, Abdul, go ahead. So I got the vaccine in the first go. And since then, I am advocating all my patients, all my community people, even people in Bangladesh, in my village. I used to ring every day since then, asking and begging people, please go for the vaccine.
Dr. Aziz, sorry to interrupt you. I want to know more detail your experience why Bangladeshi community were not interested to take vaccine when it is rolled out in the very beginning.
Yeah, very beginning, they thought that it is not good. They are not sure, and it has pork, or it will not be effective. It is not proven. And they were not happy with the vaccination at all. And most of them, they thought, no, we are not going for it. So that was the initial reactions. But after convincing them, whoever came in touch with me, I tried to convince most of them that no, it is safe, and I have taken it, okay, and I have showed the proof. And I told the other people who are taking this one, and there's no pork in it. And I also showed that people having the vaccine, having less infection of the COVID-19, even they are affected, they are less affected. And as I mentioned, as you saw that, our other Dr. Jina told that, even COVID-19, people are long COVID-19 are affected. People with vaccinations, they are affected much less than those people are not taking vaccine. Even children, even babies, mothers who are taking this vaccine during pregnancy, babies up to 6 months old, they are having less infections than those mothers who are not taking the vaccine. It is proven that all of us
government, I have another question. The government has taken a lot of initiative to create an awareness among the British Bangladeshi community. The community champions were taking initiative. You doctors were taking initiative. I have seen number of videos published by the Public Health England and Council. They are circulating a lot of information. Do you think the language barriers were one of the reasons they cannot access the government information according to the time, or government information was not available in the bilingual services? That is why they were unable to reach the message.
Yeah, I mean, you are right that as a not only about vaccine, as a BME group of people, we have a lot of disadvantage in language, in the housing, and all those things, getting information, getting into media. We are between less, encouraged or less access to the media than the other white people. And it is true that we need to do more about our community and about our media, and to go door to door to these disadvantaged people and encourage them to come forward and have the vaccine as soon as possible.
And another question raised by our guest from the Arab community, Marwan. She explained the Arab community was very anxious about it's not been safe because it's not been tested long enough and could be harmful and don't know what the long-term effect would be. Do you think this statement and this observation is correct?
No, it is not correct, okay? And that's what we want to prove to our patient, to our community people, by showing the examples that we doctors, as we people who know a little bit more about the vaccine, we are already taking it. So if it's a life risk, we will not take the risk, but we are taking it easily, and we are getting benefited. I was, this infected most probably third time. Well, I was in Bangladesh this time. I was also, infected. I had to cancel my flight. But I was not affected as we should expect, okay? If I was not vaccinated, I would be really, really very unwell.
And I don't deny some of another point raised by Marwan, and she wrote there is a split reality where some took it straight away and some others still refusing due to lack of information and readily available in their language. That was I mentioned earlier. Maybe Arab community doesn't have the enough bilingual information to reach out about the vaccine information.
Yeah, I agree with you. Although through the media, we have also a responsibility as a community, so people, community, and we are this know about it, that we should have more work to do to reach this information to every household, and we should do more this advertisement and do this kind of more often this kind of programs and involving these ordinary peoples, so to give the message that we should go forward for the vaccine.
So thank you very much, Dr. Muhammad Abdul Aziz. Now I'm going back to Islamic issues. We have Maulana Nazrul Islam. আমি একটু বাংলায় বলছি. Some of the viewers will be comfortable in Bengali language. Maulana Nazrul Islam, you can speak in Bengali or you can speak in English. It's up to you. আপনি কি মনে করেন যে ধর্মীয় কারণে আমাদের ব্রিটিশ বাংলাদেশি কমিউনিটির একটা বড় অংশ ভ্যাকসিন গ্রহণে অনীহা প্রকাশ করেছে? আপনার অভিজ্ঞতা কি? আপনি কি দেখেছেন? মাওলানা নজরুল ইসলাম, খতিব এন্ড ইমাম, ব্রিকল্যান্ড মস্ক।
ধন্যবাদ। আসসালামু আলাইকুম রহমতুল্লাহ। যেহেতু ভিউয়ার্সদের মধ্যে আমাদের বাঙালি কমিউনিটি আছেন তাদের, এবং আমরা বারবার লক্ষ্য করছি যে তারা ইংলিশ ল্যাঙ্গুয়েজ কম বোঝার কারণে এই বিষয়টাতে ইনভলভ কম হয়েছে। এ ব্যাপারে আমি আমাদের কমিউনিটিকে প্রথমে আমরা দেখেছি দুইটি প্রপাগান্ডা বেশি কাজ করেছে, বেশি এফেক্ট করেছে আমাদের বাঙালি কমিউনিটিকে বা মুসলিম কমিউনিটিকে। প্রথমত ধর্মীয় একটি ইস্যু ছিল যে এটা হালাল না হারাম, এই ব্যাপারে বহুত বিতর্ক হয়েছে, এবং এই বিতর্কের পর আমরা কয়েকটি অনলাইন শো করেছি, যেটা থেকে আমরা দুইটি পয়েন্ট আমরা বুঝাতে সক্ষম হয়েছে আমাদের মুসলিম ভাই বোনদেরকে ইসলামী ইস্যু থেকে। যে একটি বিষয় হচ্ছে যে আমরা এই প্রথম যিনি ভ্যাকসিন আবিষ্কার করেছিলেন তারা মুসলিম কাপল ছিলেন। দ্বিতীয়ত আমরা দেখেছি যে এই ঔষধ নিয়ে যারা কাজ করেন তাদের এক্সপার্ট যারা, তাদেরকে আমরা জিজ্ঞেস করে দেখেছি এখানে এই ভ্যাকসিনে হারাম কোনো কিছু ছিল না। এটা এই প্রপাগান্ডাটাকে আমরা এখানে স্টপ করতে সক্ষম হয়েছি। দ্বিতীয়ত এই একটি প্রপাগান্ডা যে হারাম ইউজ করলেই যে একজন মানুষ গুনাহগার হয়ে যাবে তা কিন্তু ইসলামী ইস্যু নয়। এটা কিন্তু মানুষের মধ্যে বুঝের অভাব ছিল। একটা ছিল যে একজন মানুষ, আমাদের ধর্ম তো আল্লাহ তাআলা দিয়েছেন মানুষের কল্যাণের জন্য, এবং এই কল্যাণের ক্ষেত্রে আল্লাহ তাআলা মানব জাতির উপকারের স্বার্থে, অথবা সে যখন ক্ষতিগ্রস্ত হয় তখন আল্লাহ তাআলা বহুত কিছুতে ছাড় দিয়েছেন। ইভেন কি রোজা, আমরা ফরজ রোজাটাকে আল্লাহ অসুস্থ মানুষের জন্য কনসিডার করে দিয়েছেন রোজা না রাখলে। অনুরূপ ভাবে যদি কোনো রোগ মারাত্মক আকার ধারণ করে এবং তা জীবননাশক হয়ে দাঁড়ায়, এই ক্ষেত্রে কোনো হারাম ঔষধ ব্যবহার করাও জায়েজ আছে। এই দুইও পয়েন্ট আমরা মানুষকে কিছু বোঝানোর চেষ্টা করেছি। এই প্রপাগান্ডাটা কিন্তু প্রথমেই মুসলিম এবং বাঙালি কমিউনিটিকে ভ্যাকসিনে যাইতে দেয় না। দ্বিতীয়ত আরেকটি এই যে মেডিকেল ইস্যু ছিল, কেউ কেউ বলেছেন যে মানুষের হরমোন চেঞ্জ হয়ে যাবে বা বহুত কিছু এই সেই হয়ে যাবে। আমাদের বিজ্ঞ ডাক্তাররা বা বাঙালি যারা ছিলেন তারাও আলোচনা করেছেন যে এতে ক্ষতির, ফিজিক্যালি ক্ষতির কোনো কারণ নাই। এই বোঝানোর কারণে মানুষ একটু সচেতন হয়ে ভ্যাকসিন নিয়েছেন। আমরা দেখেছি যে এই যে ধর্মীয় যে একটা প্রপাগান্ডা, এই প্রপাগান্ডাটা আফটার অল প্রপাগান্ডা হচ্ছে এক জিনিস, আর বহুত মানুষ তো মনে করে যে আমি জীবন দিয়ে দিব, তবু আল্লাহর বিরুদ্ধে যাব না, এই একটি ইস্যু আমাদের আছে। এই কারণেই আমাদের বহুত বাঙালি ভাই এবং বোনেরা এই ভ্যাকসিনে যান নাই। আর দ্বিতীয়ত যে ল্যাঙ্গুয়েজ, যেটা আপনারা বারবার আলোচনা করেছেন, যে মেইন স্ট্রিম যে নিউজ বা রিসার্চ, এর সাথে আমাদের বাঙালি কমিউনিটির 65+ বা 50+ বহুত মানুষ কিন্তু তাদের রিলেটেড নয়। এই কারণে তারাও এই ভ্যাকসিনে যাইতে সময় লেগেছে। এখন আমরা জানি না যে কি পরিমাণ মানুষ গেছেন অথবা কি পরিমাণ মানুষ জানি না, হয়তো রিসার্চ বলে দিবে। আমরা মনে করি যে এই দুইটি বিষয় প্রথমেই বাঙালিদেরকে বা মুসলিমদেরকে ভ্যাকসিন গ্রহণ করতে তাদেরকে বাধা দিয়েছে বা মানসিকভাবে তারা বাধাগ্রস্ত হয়েছিল।
তো মাওলানা নজরুল ইসলাম, আপনি জানতে চাইছিলেন যে কি পরিমাণ ভ্যাকসিন আসলে গ্রহণ করেছে। অ্যাকর্ডিং টু ইউনিভার্সিটি অফ লন্ডনের রিসার্চ বলছে পুরো ইউকে পপুলেশনের যেখানে 90% ভ্যাকসিন গ্রহণ করেছে, সেখানে বিএমই কমিউনিটির মানুষের মধ্যে 3 ডোজ ভ্যাকসিনের কথা বলছি আমি। এই ডাটাটি পাবলিশড হয়েছে 7th of April 2020, অর্থাৎ 7ই এপ্রিল 2022 সাল পর্যন্ত 3টা ভ্যাকসিন গ্রহণ করেছে এমন হোয়াইট ব্রিটিশ নাগরিকের সংখ্যা হচ্ছে 90%, আর অন্যদিকে ব্ল্যাক এথনিক মাইনরিটি কমিউনিটির সংখ্যা হচ্ছে 57 থেকে 65%। তাহলে আপনি দেখুন, এত প্রচারের পরও ভ্যাকসিন গ্রহণের প্রবণতা কিন্তু কাছাকাছি আসেনি। তো আরেকটি প্রশ্ন আমি ডাক্তার জিন্নাতের কাছে করব। ডাক্তার জিন্নাত, এখানে আমাল মাকি raised this question: the effect of the pandemic mentally among the BME is huge. What the NHS can do or did for those who have been mentally affected by the COVID-19?
Thank you very much, Amul, for your question. I mean, pandemic has affected negatively not just BAME community. I would say a lot of other people. It has had a huge impact. It's almost, a lot of people are suffering symptoms of PTSD, post-traumatic stress disorder, especially people who have worked frontline. We're losing a lot of staff, and a lot of people are going off work because of that, because of the trauma they've been through. I mean, unfortunately, in terms of NHS support, I would say the support is still limited. If you think about front door, especially in A&E or in any clinic that we run in hospital, the support is limited. There is no doubt about it, given the work pressure, there is a huge staff shortage, etc. I would advise you to have a look into your community or have work with your GP. There are long COVID clinics almost in in every council in United Kingdom, regardless of wherever you live. So I would advise you to have a word with your GP. The long COVID clinics are usually run by allied health professionals. There are expert physios, OTs. Sometimes there are doctors as well. So given your long COVID symptom, mental pressure, pressure, illness, etc., I would say have a word with your GP first, and your GP can signpost you whether you qualify to go to a long COVID clinic or not. And Tanvir Bhai, while I am given the platform to speak, can I just answer a quick, can I just try to explain Marwa's query regarding long-term effect of the vaccine? If I might just add, Marwa, you know, COVID-19 is a SARS-2 virus, and there is already vaccine available for SARS-1 virus, which is normally known as flu vaccine, which we have been taking for years and years and years, especially people who are vulnerable, slightly elderly. They're being offered to these group of people every year. You know, so, and SARS-2 vaccine, which is again not much different from SARS-1 vaccine. There has been some changes just to adapt to COVID-19, to be a bit more specific to it. So, you know, there are similar vaccines that we have been taking for years without much long-term side effect. And it has been proven on various quality control studies that this vaccine is halal certified. This is safe. It does not have any long-term side effects. It does not alter your DNA. It does not have any effect on your unborn child. So I can't emphasize enough how safe it is. And if you look at the UK healthcare professionals, more than 90% of your healthcare professionals are triple vaccinated. So I think that's telling how safe it is, you know. So we wouldn't be taking it if it wasn't safe, if that makes any sense, you know. So it is very, very safe, and I totally agree that people have limited access if you're not bilingual. If obviously English is not your first language, there are limited options for people from ethnic background. If you're speaking a second, if you have other language as your first language, but I would still advise contact your GP and tell them that that's my first language. I would like to have a bit of information on this, on my language. I'm sure your GP surgery, your nurse will be able to help you, your GP will be able to help you. There are obviously signposting regarding COVID vaccination in various different languages. You can find information on NHS websites as well. They're published in different languages as well.
Thank you, and Dr. Zinnat Khan. Now I'm moving to Dr. QM Obaidul Alam. Dr. Obaidul Alam.
No, sorry, yeah, Ohidul Alam.
So Ohidul Alam, I beg your pardon. Dr. Ohidul Alam, can you please share your experience and thoughts in this regards, please? You have to unmute, Dr. Ohidul. You have to unmute.
Unmute.
Is it okay?
To unmute. Yeah, yes, fine.
Okay. Good morning and assalamu alaikum to everybody. First, with few words, I would like to introduce myself. I am an asthma specialist. I practice on asthma and allergy in Chittagong, and I am a long-time friend, about 50 years, long-time friends of Dr. Aziz. So in that way, I am privileged to participate with you people. There are two questions. It is not the fault with Bengali community or black community in UK, as far as I understand from the scientific point of view. When it was started in Wuhan in December, from December to June 30th of 2020, 1 lakh scientific papers were published on COVID-19. So not only common people, even doctors were confused about this huge volume of information, and we were puzzled which are to be taken, which are to be discarded. So in that context, I think Bengali community should not be burdened that why did not accept these vaccines. There are two reasons as far as I understand. Number one, from the producers of vaccines, some people were saying this is better, some people were saying that is better. People were confused. So maybe they would have hold on. Number two, even there were some people were taking, we have taken 1 dose, 2 dose, but still we are taking. So people were perplexed, confused. Not that because of their ethnicity, I think it is not perfect data. Number two, when you say that among Bengalis and black Africans of East London, mortality and other things are more than white people. Even from the beginning, not only in UK, even in America, throughout the Europe, people were reluctant to take asthma jab, COVID jab. So in that case, people were puzzled. Number two, maybe, for example, in Bangladesh, it was huge success. We have vaccinated 3 doses of vaccines to 29 crores, 290 doses we have given. So in that context, why was it successful? Because of motivation. We had successful motivation throughout the villages. So I think here motivation was less. People would have taken it, no matter whether his Muslim belief or not. Even when our Maulana Nazrul Islam Sahab told that it is Islamic, it is very Islamic. When one people went to Prophet Muhammad Sallallahu Alaihi Wasallam and asked for medicine, he advised him some medicine and advised him to consult some doctor of respective diseases. So I think you should continue motivation and the benefits. Of course, there are hazards, but you say for Ebola vaccine, it took 20 years to find a vaccine for Ebola. For tuberculosis vaccine, it took 30 years to develop a vaccine. But within 2 years of starting of COVID, people are having so many companies of vaccines. Even in Bangladesh, we have permission of one COVID vaccine that is called Bongovax by Globe Pharmaceutical, which is enlisted by WHO. So people were confused. It is not the fault with the community, fault with unequal and inadequate information that we are providing to our patients, our community. So in that context, it is imperative, and it is of course proved that who take vaccines, who take jabs, they have less hospital admission, they have less mortality, they have lot of other diseases. So in that context, there are all positive signs that you should advise and we should take care. This message you should give to your community, whether it is in Bengali or in other communities. And another thing which Dr. Zinath mentioned, now COVID itself is not a problem for us because we are used to, and in the beginning when we lost our moral, we didn't know what to do. Now we know what to do and how to handle our patients. But now most important thing that those people who had post-COVID syndrome, we say it post-COVID syndrome, what a sequel of symptoms develop after suffering from COVID. These are the patients which are underlooked, undercared. So I think our doctors here in UK, GPs, they should screen out these patients of post-COVID syndrome. And that will be of great help for the community. Thank you very much for allowing me to say a few words.
Thank you very much, Dr. Wahidul Alam, for joining with us and sharing your experience from a Bangladeshi point of view. We have a lot of guests here. Do you have any question to our panelists? You can ask in Bengali, Arabic, English. You can ask Mohammad Samsuddin. আমি দেখতে পাচ্ছি মোহাম্মদ শামসুদ্দিন, আপনার কোনো প্রশ্ন আছে? আপনি আনমিউট করে প্রশ্ন করুন। মোহাম্মদ শামসুদ্দিন, আপনি আনমিউট করে প্রশ্ন করুন।
We can translate his question in English.
Yeah, I'll translate it. You can ask question English or Bengali.
Yeah, Assalamu alaikum. আমি মোহাম্মদ শামসুদ্দিন। আমার কোয়েশ্চন তেমন নাই, আমি ব্যাপারের সাথে জড়িত ছিলাম বিগিনিং 2020। আমি লকডাউনের 2-3 দিন আগে কোভিডে আক্রান্ত হয়েছিলাম এবং এটা ছিল খুব বেশি সিভিয়ার। এটা তখন কোনো তেমন একটা চিকিৎসা ছিল না। আমি ট্রান্সপোর্ট ইন্ডাস্ট্রির সাথে জড়িত, আমি কাজ করি একটা মিনিকেবে, এবং সে কারণে আমি বিভিন্ন লোকজনকে আমি পরিবহন করতে হয়। সেখান থেকে আমার হয়তো আমি অ্যাটাক হয়েছিলাম। আমার খুব বেশি, আমার অ্যাটাকটা খুব বেশি সিভিয়ার ছিল, আমি কথা বলতে পারি না, এমন অবস্থা ছিল। আমি ফোন করেছিলাম অ্যাম্বুলেন্সে, তারা আসে নাই, বলছে যে আমি এখনো ঠিক আছি। ওদের আরো অনেক বেশি লোকজন আছে যারা হ্যান্ডেল করতেছে। 2বারই ফোন করেছিলাম কিন্তু আসে নাই। লাকিলি আল্লাহ রাব্বুল আমাকে সুস্থ রেখেছেন, অশেষ শুকরিয়া আল্লাহর দরবারে। আর আমার একটা জিনিস হলো যে আমার পরিবারের সবাই ভ্যাকসিন নিয়েছে, কিন্তু যে আমাদের মৌলানা সাহেব আছেন বা আমাদের অনেক লোকজন, প্রফেশনাল লোকজন আছেন, ওনারা যে এগিয়ে এসেছেন এবং তথ্য দিয়েছেন, সেটাতে আমাদের অনেক উপকৃত হয়েছে। আমাদের লোকজনরা কিন্তু নিচ্ছেন না ভ্যাকসিনেশনটা, এখন পর্যন্ত অনেকেই নিচ্ছেন না। তো আমার এই প্রশ্নটা হচ্ছে যে আমরা আরো কিছু এই ব্যাপারে বা বিভিন্ন সময় আরো কিছু জিনিস আসতে পারে, সেখানে আমরা একটু অ্যাক্টিভ হব, এবং কিভাবে হব আমাদের যারা আছেন প্রফেশনাল ওনারা একটু অ্যাডভাইস দিবেন, এবং অ্যাডভাইস আমরা গ্রহণ করবো, এটাই আর কি। থ্যাংক ইউ।
Thank you very much. Mohammad Samsuddin was talking about his experience. He was badly affected by the COVID-19 and he lost his voice, and as a taxi driver he contracted coronavirus when he was driving, and he called an ambulance, and they were not picking up the phone or didn't come on time. So that was his suffering during the pandemic. Now I'm moving to another guest, ফয়জুর রহমান খান. ফয়জুর রহমান ভাই, আপনার কোনো প্রশ্ন আছে? বা
আসসালামু আলাইকুম সবাইকে।
জি,
সুন্দর একটা প্রসঙ্গ নিয়ে আসছেন। আমি 2001 অক্টোবরে 3 নম্বর ভ্যাকসিনটা দিয়েছিলাম। আমার 3টা কমপ্লিট ছিল। তারপরেও আমি জুনে গেছিলাম বাংলাদেশে। বাংলাদেশ যাওয়ার পরে আমি অসুস্থ হয়ে লন্ডনে চলে আসি। আমার 24 জুলাই আসার কথা ছিল, আমি 17 জুলাই চলে আসছি। বিকজ অফ আমার শারীরিক অসুস্থতার কারণেই আমি চলে আসছি। এবং এইখানে আসি আমি
কোভিডে আপনি আক্রান্ত হয়েছিলেন বাংলাদেশে গিয়ে?
জি, আমি তখন চেক করি নাই। এইখানে আসি, আমি হসপিটালে গেলাম, তখন তারা বলল যে আমি কোভিডে আক্রান্ত। আমার প্রশ্নটা হলো, বিজ্ঞ এখানে 3 জন গুণীজন আছেন ডাক্তার, উনাদের কাছে আমার প্রশ্ন, আমি 3টা ভ্যাকসিন নেওয়ার পরেও আমি কোভিডে আক্রান্ত হলাম, এবং আমি সিরিয়াসলি আক্রান্ত হলাম। আমি কথা বলতে পারি না, আমার কফ, জ্বর, সর্দি সবগুলাই আমি আক্রান্ত হয়ে, ইভেন কি মুখের ভিতরে এত চিতা ছিল, আমি কল্পনাও করতে পারি না যে কি আমার মুখের ভিতরে, এটা কি কেউ পুশ করেছে কিনা, কেউ ভিতরে দিয়েছে কিনা, এইরকম চিতা ছিল আমার মুখের ভিতরটা। কারণ আমি বিজ্ঞ 3 জন ডাক্তার সাহেব আছেন, ওনাদের কাছে আমার প্রশ্ন যে আমি 3টা ভ্যাকসিন দেওয়ার পরেও আমার কেন এই অবস্থা হলো?
Thank you, Fazur Rahman Khan. Dr. Zinnat, can you please explain his question? He takes 3 vaccine, one of the 3 recipient, the highest vaccine recipients among the Bangladeshi community, and been affected coronavirus when he went to Bangladesh.
Assalamu alaikum. I'll try to answer it in English for greater sake of other audience as well. I'm very sorry to hear that even after 3 vaccination that you suffered so badly with COVID. Now we just need to understand a bit about the formulation of the vaccines over here. The reason the vaccines are offered in multiple doses, dose 1, dose 2, dose 3, and 4th dose is now being offered, and there is talk about yearly doses, just like flu vaccine. The reason behind that is these vaccines lose their effectivity as time passes, if that makes any sense. So a lot of data would suggest that as soon as you're vaccinated, you have little protection. In the first few weeks, the protection level peaks. And as months go by, at the end of 4 to 6 months, depending on which brand you're taking, the effectiveness of vaccine goes significantly down. So that's why people are now being invited for 4th dose of vaccine. And there are talk about yearly vaccines, just like flu vaccination, so that your protection level, the antibody levels remain as high as it should be, or where it should be. So the whole idea about the antibody levels or the protection that you get from the vaccination is if you have the optimal level, hopefully, even if you get the COVID infection, hopefully your symptoms will be mild. But if you have lower levels of protection despite multiple doses of vaccination, even if you get COVID infection, unfortunately, you are at risk of, severe infection. Now, I'd like to clarify this to our audience here. The whole point in giving vaccines or receiving vaccine or repeated doses of vaccine is to prevent severe infection. It does not protect you from having COVID. It protects you from severe infection. So even after vaccination, you can have COVID, but hopefully and likely your infection will be milder, if that makes any sense. The longer you're left without vaccination, likelihood that you'll get more severe infection. So I'm actually not aware of the timing of your vaccines. If they were 6 months or over since your last dose of vaccine, likely your protection or antibody levels are quite low. So you'll be at risk of severe infection.
So thank you, Dr. Zinat. A lot of people are asking me how many at the very beginning, how many vaccine I should have take. The first dose, second dose, third dose. The pandemic is not going over. Shall I have to take a fourth, fifth, and sixth, and new diseases coming? So is there any research found how many vaccine a human body can take in a year or 6 months?
Right. That's a very good question. The answer to that is I don't know. I will only advise you, please go by government guidelines, depending on which country you live in. So 3 doses of vaccine is fairly standardized all over the world now. People are being invited for 3 doses of vaccine. A lot of people in UK are being invited for 4th dose of vaccines, especially people who are elderly, vulnerable, who are on immunosuppressant or who are immunosuppressed for whatever reason. They're being called for 4th dose of vaccine. And I think there is talk about rolling it out to community. There is also talk about yearly COVID vaccine for entire population, just like flu vaccine. So how many vaccine we can take? That's a very good question. All I can say, if you're being invited for the 4th dose of vaccine, please go.
In the childhood, below 5 years, the children and kids are taking immunization. They took 5 or after 6 months or a year after, or 2 years when they are at the age of 2. But as an adult, how many vaccine, the similar mRNA vaccine can people take in a year? 3, 4, and monkeypox is coming. So are you going to offer us to take vaccine again and again? So that's need to be making a clear research, and then people can get confidence on it.
And if you think about Tanvir bhai, when people are traveling, say endemic areas like places where they have yellow fever, etc., a lot of people actually, before traveling to those areas, take vaccines for those specific diseases. And vaccination program varies from country to country. So vaccination program that we have in Bangladesh is different from what we have in UK or say any other developed countries. So it all depends on your prevalence of diseases in your local community. But the general idea, the more and more people are vaccinated, you develop a kind of herd immunity. Like, for example, polio. Polio, when I was growing up in Bangladesh, polio was still there. You would still see people who are badly disabled with polio. Polio is almost unheard of now. It's almost eradicated. And that's a result of widespread vaccine uptake. And I think there is few reported cases of polio just at the border. Obviously, we are surrounded by India and there are Rohingya, etc. So it's difficult to control, but it's almost eradicated. We are almost there. If you think about smallpox, it's eradicated, and that's the result of widespread uptake of vaccination. So how many vaccines a human body can take? That's a very good question. The answer to that is I don't know. And it depends on which country you live in, where you're traveling. If you're female, you can be offered vaccines for cervical cancer, HPV virus. If you're traveling to different countries, depending on whatever is endemic in that area, you might be offered different type of vaccines as well. So I would say if you're in any doubt, have word with your GP. But as it comes to, if you just stick to our COVID vaccination, I would advise you, please take 3 vaccines. Definitely, that's now recommended that you must take 3 vaccines. The 4th dose, wait for your invitation. If you're being invited by your GP to go for 4th dose of vaccine, please go for it. And hopefully, I think it's coming. It's probably coming. It's going to be a yearly vaccine. As I said, the protection level that we get from each dose of COVID-19 vaccine, it as time goes by, your level of protection decreases.
And then positive conclusion, I can share with you, 90% of the British population has taken the third vaccine. So far, we haven't seen too many reactions from the vaccine takers. So this is the positive conclusion we can share with our viewers. So we may not have sufficient or enough data how many vaccine you have to take, but those who have taken the 3 vaccines, the reaction or bad reaction, we haven't seen so many. So that is the positive thing. We can encourage people to take vaccine. Those who are not taking vaccine, still in the fear, the 57 to 65% people from the BME community is taking the third vaccine. So definitely those who are still not taking the third or second vaccine, so please do talk to your GP and take the vaccine at your convenience. So is there any questions, Councillor Aziz? Councillor Aziz, are you here?
No, I don't have any questions, but I have some comments as well. And
so yeah, so floor is yours. If anyone doesn't have any questions, so we will conclude our consultation session. Or Dr. Aziz, do you have any observation or any answer? Do you want to add anything, Dr. Aziz, before I give floor to Councillor Aziz to conclude this session?
তানভীর সাহেব
জি
হ্যান্ড রেজ করছিলেন আমাদের বিজ্ঞ ডক্টর ওয়াহিদুল আলম সাহেব।
Oh, sorry.
তিনবার হ্যান্ড রেজ করছিলেন।
Just in minutes I will conclude.
Sorry. Yeah.
Regarding the suffering of Shamsuddin Vai, that he had taken 3 doses till mid 2021, we knew that the test may become positive even after 37 weeks. But now we have got many patients throughout the world and through many publications, so we know that even after 12 months it may become positive. Not that you have been attacked by newer variants. Maybe you had positive, your positive fineness continued till 12 weeks. That is one aspect. The another aspect, now there are mutant variants, what we call the changed form of COVID. So it is changing so rapidly that we cannot cope up with our vaccines. But still, vaccination taking is to be continued. There are 2 aspects of taking vaccination. In Europe, they are after the present ones. But in some cases, present one infection has passed earlier of the days, 12 months ago. But still, in Europe, they are practicing taking vaccines which have passed 12 years ago mutant variant. But Americans are taking the let us wait and see the current variant. So that is what I want to add.
Thank you very much. This is a very, very vital point. Why the vaccine, another vaccine you have to take, it has got a limited, time to immune your body, and then later another variant introduced. So doctors and researchers have to take initiative to develop this vaccine. And another question raised by Rabina Khatun, she has asked a question. Many people are suffer after COVID-19 vaccines because they are tried, and some people have side effects, and still after 3rd vaccines still people have COVID. Dr. Aziz, do you want to answer?
No, there is some. We need to understand what is COVID-19 and what is going on. As you know, it is a virus, and it is changing its mode of actions and its name. Okay, so it is now going on. This COVID. This what is called it variant A4, A5. Those kind of things going on. So it is a different variant. That's why people are affected by this virus. But as people are getting the vaccine, as they are, this illness is getting less and less severe than before. So we'll still get this, illness, but it will be definitely much, much less severe. And I agree with my other colleague, Dr. Wahidul Alam, that of course, scientists are always trying to get the latest vaccine, focusing those new variant, but it does not come immediately in the market. It takes a while. Okay, that's why whatever it comes, we need to follow that. That's I want to add.
Thank you very much. I'm going to ask Councillor Aziz Toki, Director of Central London Youth Development Trust, to conclude this session.
Thank you very much. Thank you all of our guests. You have given your weekend times for our show. It's really very generosity of you. I must thank you, Mr. Wahidul Alam.
Your video is off. Sorry to interrupt, Councillor Aziz Toki. Would you
I
mind
feel
to-
comfortable without video to speak without video. So, Wahidul Alam, thank you very much. You join us from Bangladesh, from Chittagong, and your contribution is really very helpful. All of our viewers are definitely benefited from your views as well and your contributions. So many contributions we have received from our guests. So many issues have been raised. So many issues have been discussed. Some issues are related to scientifically proven issues. Some issues still need to be scientifically proved. So some issues are easy to explain. Some issues are not easy to explain as well. After COVID, so many vaccine has been introduced. As Mr. Wahidul Alam said, this is a confusion again. So different type of vaccine was in the market. So people are confused. In terms of publicity, I would say yes, this is the reason, language reason, and the other purposes, the ethnic minority peoples are far behind from their counterparts. So basically, even nowadays, lots of informations are available. Government has produced so many leaflets, so many information, so many guidelines in different languages. But problem is, those informations are not going to our community. That's why we have initiated this program, Mind the Gaps program. So we are taking those information to our community. Because our community, always we say that community is not much proactive. The language barriers, cultural barriers, so many things we can raise. But important thing is the culture of the community, tendency of the community need to be changed. So that's why the important to bridge up the gaps is very important. And we have taken this initiative and supported by this Chelsea and Kensington and Chelsea Social Council, supported to bridge up these gaps. So this is one of the initiatives. What the expertise has said today, definitely the viewers, and obviously it is going to air again in our online channels. So viewers will be benefited from your contribution. Definitely will be benefited. Some issues have been discussed by our Imam. So he has spoken in Bengali, and he clearly said there is no harm to take the vaccine because this is halal. The people has introduced this vaccine in first time, they were Muslims, and they have checked that the ingredients they have been using in the vaccine are halal, there is nothing haram. Even he said, in Islam, for the sake of your life, if anything little bit haram, and if you use these things and you can save your life, this can be used. Anyway, this was his discussion. So thank you very much. Thanks our guest and viewers to participate in this show. I hope we all are benefited from today's program. I would like to request the people who have not yet vaccinated, please do it. Definitely it will keep you healthy. This program will be available in Facebook and YouTube and will air in 2 more online channels. So may I thank you, our anchor, Mr. Tanveer Ahmed, for his charismatic presentation. And I hope we will continue our work for the sake of our community. Thank you very much.
Thank you.
Yes, Tanvir bhai.
Thank you very much.
Thank you, Tanvir. Thank you, Aziz bhai, for inviting us for a nice this the program. Is good for the community. You and we all are working for the community. We always wish best for the community, and we should continue work for the community, inshallah.
Thank you everyone. Thank you, Dr. Zina. Thank you.
Thank you very much, everyone. It was a pleasure. Thank you.
Thank you very much. Assalamu
Thank
alaikum.
you. Assalamu alaikum.
A special thanks to my friend, Dr.
Thank you
Wahid
very
Alam.
much.
Thank you, thank you.
The recording has stopped.
Good. Well done, Tanvir. You've done
Thank
good job. Thank you.
না থ্যাংক ইউ, আপনি যে সময় দিলেন উইকেন্ডে, এটাও তো অনেক বড় একটা ব্যাপার। ডাক্তার জিন্নাতের তো আমি খুব ভক্ত, সব সময় সোশ্যাল ওয়ার্কের জন্য মানুষের এক্সপিরিয়েন্স শেয়ার করার জন্য। শি ইজ রিয়েলি সোশ্যাল ওয়ার্ক।
আয়ারল্যান্ডে থাকেন নাকি?
জি জি, আসসালামু আলাইকুম। আমি বেলফাস্টে, নর্দার্ন আয়ারল্যান্ডে থাকি। জি,
নর্দার্ন আয়ারল্যান্ড। আচ্ছা আচ্ছা, দ্যাটস গুড, দ্যাটস গুড। আমি
আমি
সাউদার্ন আয়ারল্যান্ডে কাজ করছি।
অনেক আগে বার্কিং এ ছিলাম, 2005 এ।
আচ্ছা আচ্ছা, আমি ইউকে ছিলাম, সাউদার্ন আয়ারল্যান্ডে ছিলাম, ডাবলিনে ছিলাম 6 বছর।
আচ্ছা আচ্ছা,
অ্যাজ এ পেডিয়াট্রিশিয়ান।
আচ্ছা আচ্ছা, যাক, নো, ভেরি নাইস টু সি ইউ। থ্যাংক ইউ।
Nice to see you as well. Nice to see all of you. Thank you.
থ্যাংক ইউ শামসুদ্দিন ভাই, ফজলুর রহমান খান, রোমেনা, রাবিনা, সাবা, মমতাজ, রাহিমা, আজিম চৌধুরী, everyone, thank you for participating.
Thank you. Thank you.
Thank you, Tanvir bhai.
Thank you. Assalamu alaikum.
আমাদের দরকার প্রফেশনাল, এবং যারা এই যে রোগভোগের জন্য, অসুস্থতার জন্য, স্পেশালি কোভিড এর জন্য আমাদের দরকার যারা স্পেশালিস্ট ডক্টর, আপনাদের মিডিয়া পার্সন, এবং বিশেষ করে আমাদের যে রেসপেক্টেড ইমাম সাহেব, নজরুল ইসলাম সাহেব, কারণ ওনাদের ছাড়া আমরা এইগুলা জিনিসগুলো ফেস করতে পারবো না। কারণ মানুষরা থাকে ডাক্তারদের সাথে, ডাক্তারদের দিকে এবং ইমাম সাহেবদের দিকে এবং মিডিয়া পার্সনদের দিকে, এই তিনটা গ্রুপ, এবং আমাদের যারা শিক্ষিত আছেন ওদের দিকে আমরা আশা করব বিভিন্ন সময়ে যখন যে জিনিসটা দরকার পড়বে আপনারা এগিয়ে আসবেন। আপনাদের সবার সুস্থতা কামনা করি।
Thank you.